Welcome back. From diagnosis to remedy. What could actually be done about oral health inequity? 4 policy levers: Medicaid dental. Adult dental coverage is optional for states and varies wildly. Some states cover almost nothing. Even modest expansion would reach millions. Dental Medicare. Traditional Medicare excludes most dental care, a major gap as the population ages, and proposals to add a benefit are recurrently debated. The safety net. Federally qualified health centers and community clinics carry much of the load for the uninsured, heroic work, but no substitute for systemic coverage. And workforce reform: dental therapists, mid-level providers, could extend care to underserved areas. The evidence for their safety and effectiveness is strong. And here's the uncomfortable part: organized dentistry has often resisted them. Ask yourself whose interest that resistance serves, a question that leads straight into Chapter 7. Now, where the burden concentrates, 4 populations face acute barriers: people with disabilities, physical access, sedation needs, and too few trained and willing providers. The elderly in long term care, among the most dentally neglected people in the country, residents often go years without care. The incarcerated, they hold a constitutional right to care under Estelle versus Gamble, but it's met minimally and unevenly. And the undocumented, excluded from most coverage, and fear itself becomes a barrier to seeking care. Each of these is precisely the neighbor, the vulnerable one, the prophetic tradition names. Finally, the global dimension. Global oral health inequity dwarfs the domestic gap. Short-term mission dentistry can genuinely help, or it can serve the volunteers more than the served. What distinguishes service from dental tourism, local partnership, sustainability, follow-up, training of local providers, and humility? The chapter's thesis stated plainly: oral health inequity is not a natural fact, but a human-made structure, and the profession that holds the monopoly on care cannot be neutral about who gets it. If you hold the libertarian view, push back, but do it with reasons. Next, Chapter 7 and the tension at dentistry's core: the dentist who heals is also the dentist who sells.